Okay, so here we have the next question on lithium psychopharmacology, which is from INICET November 2022. The question is how much the therapeutic dose of lithium should be maintained in case of long-term bipolar disorder. So here the question is revolving around what should be the serum lithium levels in the maintenance phase in a BPAD patient. A is 0.6 to 0.8 milliequivalent per liter, B is 0.6 to 1.4 milliequivalent per liter, C is 0.6 to 3 milliequivalent per liter, D is 2 to 3 milliequivalent per liter. Okay, so this is a pretty straightforward questions. So we must always remember that lithium is having a very narrow therapeutic index. That means even the dose fluctuates little bit, it can move from therapeutic levels to toxic levels. So let's look at something which is known as the lithium meter. Okay, this is taken from Mali et al. 2017. Okay, so here is a number of guidelines which is not that important for you. Which is more important for you is this part. Okay, this part you should remember. So the maintenance phase is between zero point 0.6 to zero point 0.8. Okay, so our answer is zero point 0.6 to zero point 0.8. Okay, so this becomes our answer. So here we can see anything which is beyond 1.5 is clearly toxic. Okay, the highest acceptable therapeutic range is 1.2. Okay, so over here we can see everything other than option A has crossed 1.2. See, everything is more than 1.2. So wherever the option is one more than 1.2, it is going towards toxicity, and anything beyond 2 is definitely toxic. So these two things are never therapeutic. Okay. So this is what CTP tells, that the therapeutic plasma levels of lithium range from zero point 0.5 to zero point 0.8. This is for the maintenance dose, as we have seen in the lithium meter, and levels above 1.5 shows toxic levels. Okay. So once again, we just see. So see, depression is covered by a serum lithium levels of zero point 0.4 to zero point 0.8, and in the acute manic phase, it should be between zero point 0.6 to 1 millimoles. Okay. So once again, depression is zero point 0.4 to zero point 0.8, and mania is zero point 0.6 to 1. Okay. So this is one of the summarizing diagrams I'd like to show. So below zero point 0.6, it's ineffective where there is a high risk of relapse. So this is for prophylaxis. The ideal range is zero point 0.6 to zero point 0.8. In zero point 0.8 to 1.2 is for acute mania, which we usually keep during a small duration till the acute manic phase is over. And beyond this 1.5 as per CTP, or even according to the lithium meter, that is Mali et al., it is more than 1.2, which is the toxic threshold where we can see the side effects like vomiting, diarrhea, seizures, even cardiac abnormalities. Okay, so this is few of the numerical values that you must remember, because these are often there in the previous year questions. So as a shortcut, always remember, if someone is talking about lithium levels, it's never crossing 1. Okay, so it's always below 1 for all generalization purpose. Anything below 1 is can be considered normal, and anything above say zero point 0.5, which is zero point 0.6 over here, but for a rough guide, so anything between zero point 0.5 to 1 can be considered a normal. Okay, out of this, if you have to further refine it, it is zero point 0.6 to zero point 0.8 for maintenance phase, and zero point 0.8 to 1, or sometimes people tell it as 1.2 as the acute manic phase. Okay. Okay. So with this, we complete the discussion of this question. Hope you have learned something. Thank you very much. We will see in the next session.